Good evening, everyone. Today we'll discuss about the Posiedon group. Okay, Posiedon group for the Posiedon group for ovarian reserve. Ovarian reserve. In infertility patients, you have to categorize the based on the Posiedon group. You can give a prognosis. The prognosis based on this group prognosis. Okay, based on the ovarian reserve, you can tell what is the good prognosis, whether there are fertility, chances of pregnancy, chances of number of oocytes. It will be better if they will go for a ovulation stimulation cycles. Okay, based on this, you can hear the parameters. What are the three parameters used in this Posiedon group classifications? First is the age of the patients. Second is the ovarian biomarker. In the ovarian biomarker, they include the anti-Mullerian hormones and anti-AFC and number of cycle retrieved. Okay, so three parameters they use in the Posiedon group. One is age, one is ovarian biomarker. In the ovarian biomarker, two parameters. One is anti-Mullerian hormone, AMH level, and antral follicle count. And the third one is the number of oocyte retrieved if previous ovulation stimulation cycles. Okay. Okay, so first is the, if it is, when you told in the Posiedon they have a group 1, group 1, group 2, group 3, group 4. The group 1 and 2, okay, remember the group 1 and 2 is adequate ovarian reserve, group 3 and 4 is poor, 3 and 4, group 3, group 4 is poor ovarian reserve. Again, in the 1 and 2, you can classify as a young and older. This have a adequate ovarian reserve. I have told three parameter. Age, first is the age. In the group 1, age is less than 35. Antral follicle count is more than equal to 5, and the anti-Mullerian hormone level is, serum AMH level is more than equal to 1.2 nanogram per ml. Very, very important. Here less than 35, not equal to 35. If it is equal to 35, it is gone into older group, that is group 2. Okay, again, the based on the number of oocyte retrieved in the previous ovarian stimulated cycle, if it's again they have subgroup based on the number of oocyte retrieved. If less than 4 oocyte retrieved in the previous ovarian stimulated cycle, it is group subgroup 1A. If it is 4 to 9 oocyte retrieved in the previous ovarian stimulated cycle, it is group subgroup 1B. Okay, so first Posiedon group 1 is less than 35 years, a antral follicle count more than equal to 5, anti-Mullerian hormone level is more than equal to 1.2 nanogram per ml. Then based on the number of oocyte retrieved in the previous ovarian stimulated cycle, if it is they have divided 4A, 1A, 1B. Okay, again 1A subgroup is if less than 4 oocyte is retrieved in the previous cycles, it is subgroup 1A. If it is 4 to 9 oocyte retrieved in the previous ovarian stimulated cycle, it is 4 to 9, that is 1B, that is adequate ovarian reserve. Young, then older cases, more than equal to age first is more than 35 years, antral follicle count more than equal to 5, serum AMH level is more than equal to 1.2 nanogram per ml. Again same thing, 2A and 2B is based on the number of oocyte retrieved in the previous ovarian stimulated cycle. 2A is less than 4, 2B is 4 to 9 oocyte retrieved in the previous ovarian stimulated cycle. So 1 and 2 is totally 1 and 2 is adequate ovarian reserve, adequate 1 and 2. Okay, a young olders, AMH more than 5, AMH and AFC count equal, because adequate means AMH, AFC should be normal level, like more than 5, antral follicle count, AMH should be more than 1.2 nanogram per liter, but the difference is the age. Youngest less than 35 years, more than equal to 35 years in adequate ovarian reserve. Same thing in the poor ovarian reserve, group 3 and group 4. Group 3, here young and older. Young is less than 35, older is more than equal to 35. Then here you can put the AFC and antral follicle count, AMH level less than 5 or less than 1.2 nanogram per ml. Here also same. So group 3 and group 4. So very, very simple to remember. Group 1 and 2, remember how to remember? I told the basic things. The group 1 and 2. Okay, Posiedon group 1 and 2 is totally group 1 and 2 is adequate ovarian reserve. Adequate means adequate, if it should be adequate, then what will the antral follicle count? If it is antral follicle more than 5 and AMH level more than 1.2 nanogram per ml. Here you can add young and older. Okay, here also same, FC more than equal to 5, AMH more than equal to 1.2 nanogram per ml, but here the age, young age means less than 35, old age means more than equal to 35. This is Posiedon group 1 and 2. Then next is the based on the 1A or 1B or 2A or 2B is based on the number of oocytes in the previous ovarian stimulated cycle. If it is the less than 4, that is 1A. If it is 4 to 9, that is 1B. Same. If it is less than, in the older group, if it is less than 4 oocyte treated with the previous ovarian stimulated cycle is 2A. If it is 4 to 9, it is 2B. Okay. This is 1 and 2. This 3 Posiedon group 3 and group 3 is poor. I told you divide poor ovarian reserve. Poor ovarian reserve. In poor ovarian reserve, again young and older. I know I told poor means what will happen, the AFC count. Poor means AFC and AMH level. You have to see FC and AMH level. AFC is less than 5, AMH is 1.2, less than 1.9 nanogram per ml. In both side also it is same. AFC, AMH, AFC less than 5, AMH less than 1.2 nanogram per ml. Young age, old age. Young age less than 35, old age more than equal to 35. Group 3, group 4 is poor ovarian numbers. Very, very simple to remember this. We can ask many times, they will ask in this question in the NEET SS questions. Okay, young age, older age, adequate ovarian reserve. Adequate, first is you have to think about 1 and 2 is adequate ovarian reserve. Again 1 and 2 old and younger. Adequate means AFC and AMH has to be normal. That means it is more than 5, more than equal to 5 antral follicle count, and AMH more than 1.2. Here are the same, but young is less than 35, older is more than that. Based on the number of oocyte retrieved, less than 1A 1B or 2A 2B is less than 4 to 9 of number of oocyte previous ovarian stimulated cycle. Then group 3 and group 3 and 4. Group 3 and 4 is basically poor ovarian reserve. Poor means what is poor? Poor means AFC is less than 5, AMS is less than 1.2 nanogram. Same here also, same here also. Again you can change 3 and 4. 3 is young, 4 is old. Okay, very, very simple to remember. Okay, if you like this video, please subscribe and comment. Thank you.